Join us as we cross Canada to celebrate innovative nations leading the way in community planning. Coast to coast, we will explore the 7 C's of community planning: culture and languages, community-driven, nation-based, community engagement, communication, collaboration, connection, and commitment. Community-led planning is central to good governance and nation building. By bringing the voices of citizens together to explore the past, acknowledge the present, and envision the future, Indigenous communities and nations across the country are rebuilding themselves and creating positive, lasting change. The First Nations Health Managers Association, or FNHMA, has built strong training, certification, and learning tools that focus on clear communication and consistent support for First Nations health directors and managers developing community-led health plans. This clear and consistent communication leads to greater transparency, accountability, and stronger governance.
My name is Marion Crow. I am the Chief Executive Officer at the First Nation Health Managers Association. I do hail from Pie Pot First Nation in Saskatchewan and have been working in First Nation health since the 90s, dating myself a bit there. It is an honor to be joining you from unceded, unsurrendered Algonquin territory for this interview. The First Nations Health Managers Association, founded in 2010, is a national professional association exclusively serving the needs of individuals working for or aspiring to health manager and leader positions with First Nation organizations. We are committed to excellence in expanding health management capacity for First Nation organizations. It also means that you can get professional development training, learn from toolkits and toolboxes, and academic focused resources that are written by and for First Nation health managers. We actually have the very first textbook written by certified First Nation health managers at our association. The other piece of information I want to share with you is we do have another resource available at the First Nation Health Managers Association, and that is the Community Health and Wellness Planning Toolkit. In 2006, Indigenous Services Canada reached out via the First Nations and Inuit Health Branch. Their goal is to devolve community health administration to First Nation control. We see an amazing living example of that devolution living in the First Nations Health Authority of British Columbia. That tripartite agreement was born out of devolution. But a lot of planning has to go into moving First Nation-led health service delivery from government to First Nation control. The journey started with First Nation health managers. The journey was that the Assembly of First Nations and the First Nations in Inuit Health Branch had a joint forum on administrative functions. They also realized that the First Nations Mental Wellness Continuum Framework, developed by Thunderbird Partnership Foundation, had significant traction in moving mental wellness forward. So we had the Mental Wellness Continuum Framework, we had the administrative functions as a subcommittee that was feeding into how do we move forward with the devolution of our own controlled health services. We had the FNHMA board and that our organization. So it meant that we were able to take focus groups of hundreds of individuals that shared their experience and their wisdom, and we integrated their lived experiences, wisdom, and their wise practices into the learnings from the First Nations mental wellness continuum framework and others. Having culture as the foundation for community health and wellness means that we bring in knowledge, language, relationships, purpose, meaning, and practices to community health and wellness planning. It means that each community or nation will represent culture in a way that's meaningful to them. If you have a comprehensive community plan, this marries beautifully with that. We wouldn't do one without the other. It applies to all the different sectors and marries to your comprehensive community plan. And you do it through 7 stages. We had 4 values. Notice the numbers and how significant those are to our communities. 4, such a strength-based number. 7, the 7 grandfather teachings. 7 generations of learning. Well, now we have 7 stages of planning. And there's 7 Ds. We've made it easy. You discuss the process, you design the work plan, you discover the current situation, you define those priorities, you develop the draft, you deliver the plan, and then you do the work. Sounds easy, doesn't it? The First Nations Health Managers Association offers courses, curriculum, professional development, and a national annual conference every year. If you want to be in the heart of First Nations health service delivery with amazing leaders from all across Canada, you need to be at the First Nations Health Managers Association National Conference. We offer a whole program of innovation, wise practices, and things that are happening today across First Nation health landscape delivery. We bring together partners, pan-Canadian health organizations, funders, all come to watch us celebrate and join with us as we lift First Nation health services delivery, and we wrap our arms around our loved ones who lead health services and community health and wellness planning for our kin across Canada. You too can be part of our family. Sign up to our newsletter, check out our tools and supports on our website, take our training in person or online. You can do that by visiting FNHMA.ca.